And it's been getting headlines across the country and the world. As we've been reporting, Philadelphia is the first major city in the U.S. to reinstate the mask mandate, and it's an effort to try and save off a potential wave, the latest Omicron subvariant. We want to bring in Dr. Cheryl Bettigole now because we want to know what this means, because we aren't the only ones dealing with COVID, of course, and dealing with this new variant, and we're trying to maneuver. But why are we the only ones making this decision to put our masks back on inside? Good morning.
Good morning.
So what do you say to that? Why are we the only ones doing it? The only city in the country is making this decision.
You know, I can't really speak to why other cities haven't made this decision. I can tell you why we're doing this in Philadelphia. And we're doing this in Philadelphia because we've looked at the data from the whole of the pandemic, you know, with a special focus on what happened in January. And the reason for that January focus is in January, we were very well vaccinated. Many people had had COVID. It was a milder variant. And we still saw a huge number of hospitalizations, really just overwhelming, and 750 deaths in a 3-month period. And there's really nothing qualitatively different in Philadelphia other than the fact that, you know, there are many people in the city who did have Omicron relatively recently. So we're hopeful that this BA2 wave, which is what we think we're seeing now, that this will be smaller, that this will be milder, that we won't see a big increase in hospitalizations. But we have yet to see any wave of COVID that didn't lead to a wave of hospitalizations. When we look at the UK, which has very similar vaccination rates, had a very similar January Omicron 1 wave, they saw very high hospitalization rates, in fact, still have them. And they are seeing an increase in deaths. It's pretty substantial. So, you know, that information from the UK makes us cautious. Masks are annoying. There is no doubt that they are annoying. I don't like wearing them either. But they're a relatively mild intervention that could help to save lives. And I think throughout this pandemic, Philadelphians have shown that they are willing to do things that are annoying to take care of each other.
So
that's essentially what we're doing.
Dr. Bettigole, with the numbers right now, the cases are going up, but it's like by like 10s or by 12s. And by percentage-wise, it seems like it's astounding, 75, 80%. But when we look back at the numbers in December, January, we were having 4,000 cases a day. Now we have 142 cases a day. And we're just not seeing those hospitalizations. So people are really frustrated. I think it's hard to say, you know, when like you look at the relative number of cases, and they're saying like it's really not that many people.
Well, keep in mind, firstly, that our estimate of cases is an underestimate. It's people who were sick enough that they went somewhere to get tested, because we're not getting those home tests. So, and 142 up from actually an average of 94 just a few days ago, that's a big rate of increase. Also keep in mind that hospitalizations lag an increase in cases by a few weeks. So we will know soon if hospitalizations are going to follow. We'll look again at our metrics if they do not. But if we wait for hospitalizations to go up, it's hard to go back from there.
But the interesting thing is we're talking about the issue now, and we say there might be a lag, and we might see the effects later. Some folks are wondering, well, if this is so dire where we need to put our masks back on, why are we waiting a week to have it happen? Why not just go ahead and do it now and have that happen? I know it's been mentioned, oh, well, so people have time to prepare, restaurants have time to prepare, but isn't it just a matter of, hey, put on your mask, or we can write a sign that can be done in a day or two?
So we are trying to be reasonable in how we work with businesses. We know that this is challenging for them. And so we gave them a week to make sure also that we get the word out. So we're not, you know, going out to a business to tell them they did something wrong if they didn't yet know. So we're using all our networks to get the word out to them. But we do think this matters. And we also know that, you know, making this announcement means that Philadelphians will also hear it and hopefully put those masks on.
Well, they did put out a statement. We do have a statement from the Restaurants for Pennsylvania, and they said, we are extremely disappointed to hear that the city plans to mandate that masks be required when dining indoors without any input from the mitigated community. And I believe there's a little more to it. It says, this announcement is a major blow to thousands of small businesses and other operators in the city who were hoping this spring would be the start of recovery. While the rest of the Commonwealth has moved forward navigating with COVID, Philadelphia has stepped back by imposing another mandate and expecting it to be enforced by businesses and their employees. What's your response to that?
So when we put together the COVID response levels, this, you know, the mask precautions being a piece of that, we talked with many stakeholders, including that same group, at length. And they asked for predictability and transparency. And we're happy with those levels at that time. Now, of course, we were all hoping that cases would not go back up, but also knew that we were likely to see other variants. So we are doing what we said we would do in conversations with the business community. And, that hasn't changed. Now, again, if hospitalizations truly become disassociated from case counts, that will change our metrics. But I don't think anyone's going to complain if that happens.
No, that would be a great thing to see. Right now, the CDC has us in a low transmission period or a low category. Would there be, people just want to know how long is it? I think that's the frustration. So, we're going on spring break, people will be traveling, we'll have some cases go up. But if we're not seeing the hospitalizations also go up as well, could we get out of this mask mandate sooner than later?
Yeah, we'll be watching. We would anticipate over the next few weeks that we would likely see an increase in hospitalizations as cases rise. If we don't see that, we will absolutely revisit. I would caution you, though, that we have started to see a rise in hospitalizations in the states of New York, New Jersey, and Delaware. So, the idea that this wave isn't going to cause any hospitalization increase, I think, is maybe overly optimistic.
We'll certainly be checking for that. But should we just tell people, is this how it's going to be? We've had these masks off for, a month, maybe a month and a half, and then now we're putting them back on. Is this every time there's a new variant? Should we just pull it back out and have to put it on? Is this what the new reality is? I feel like maybe people will be able to adjust better to that than just saying, hey, you can take off your mask, and then all of a sudden, weeks later, oh, no, okay, no, put them back on. Oh, no, wait, you can take them off, put them back on.
Well, again, the COVID response levels were intended to kind of lay out for people what to expect. That if there's a variant that is new enough, different enough that it causes a substantial rise in cases, we might need to go to masks or to other measures to address that. Again, we're all watching to see what happens with hospitalizations and hoping that we reach a point where this is more like a flu or a cold, where it's an annoyance, but it doesn't cause people to get sick enough to need to go to the hospital or an increase in deaths. We aren't there yet. The fatality rate of even Omicron is much higher than seasonal flu. So we really haven't yet seen that happen.
Yeah, we're just looking at what the metric is right there. So it says hospitalizations are under, this is for level 2, under 100. Right now, for the level 1, the hospitalizations were under 50. And I think we're at 44 right now. So we're certainly still under that. We hope it just stays under that. And maybe we can go ahead.
Yes, yesterday we went to 55. So, it may wobble for a while in terms of the hospitalizations, but what we've done with the thresholds, it gives us a little bit more predictability.
Okay, well, Philadelphia doing another first, being the first to put the mask back on. Thank you, Dr. Bettigole, for trying to navigate this world, and thank you for talking to us to help explain, because I'm sure folks had a lot of questions and a lot of reactions to the news yesterday. So thank you.
Thank you.
Thank you.
Okay, we're taking a break.